Hi, everyone. My name is David Odige, and in this section, we're diving into a comprehensive medication guide focused on valvular heart disease and vascular and venous disorders. These medications are essential for managing cardiac and vascular patients safely and effectively. By the end of this session, you'll understand drug classes, why they're used, key side effects, contraindications, and the most important nursing responsibilities. Let's get started. Valvular heart disease affects blood flow across the heart valves, leading to symptoms such as congestion, arrhythmias, or reduced cardiac output. Our medications aim to reduce workload on the heart, improve blood flow, manage symptoms, and prevent complications like pulmonary congestion or thromboembolism. Let's break down each drug class used in VHD and its nursing implications. First, we have diuretics such as furosemide and thiazides. These are usually taken daily and help reduce preload by removing excess fluid. They're used in conditions like mitral stenosis, mitral regurgitation, aortic regurgitation, and tricuspid valve disease. Important side effects include hypokalemia, hypotension, and dehydration. They are contraindicated in severe electrolyte imbalance and anuria. As nurses, monitor potassium, blood pressure, daily weights, intake and output, and renal function. Always watch for signs of dehydration. Next are ACE inhibitors such as enalapril and lisinopril. They are taken daily and work by reducing afterload and improving cardiac output. These are commonly used in mitral regurgitation and aortic regurgitation. Side effects include cough, hyperkalemia, and hypotension. Monitor blood pressure, renal function, and educate on angioedema signs. Beta blockers like metoprolol and propranolol reduce the heart rate and improve diastolic filling. They are used in mitral valve prolapse symptoms and mitral stenosis with atrial fibrillation. Side effects include bradycardia, fatigue, hypotension, and bronchospasm. Do not give to patients with severe asthma, heart block, or very low heart rate. Nurses must assess heart rate and blood pressure before giving the medication, monitor for worsening heart failure, and use caution in patients with asthma or COPD. Calcium channel blockers like diltiazem and verapamil are used daily or via intravenous to decrease heart rate and control atrial rate in mitral stenosis with atrial fibrillation. Monitor heart rate, blood pressure, and electrocardiogram and assess for edema and constipation. Positive inotropes such as digoxin increase contractility and decrease heart rate in atrial fibrillation. It is used in mitral stenosis or regurgitation with AF and in aortic regurgitation with heart failure. Side effects include nausea, arrhythmias, and visual changes like yellow halos, classic signs of toxicity. Use cautiously in renal impairment and never in ventricular arrhythmias. We must check digoxin levels, monitor renal function and potassium levels, and always assess apical pulse before administration. Vasodilators such as nitrates decrease both preload and afterload, reducing cardiac workload. Used in chronic aortic regurgitation or mitral regurgitation with angina, cautiously. Side effects include headaches, dizziness, and hypotension. Never use in severe aortic stenosis or with PDE5 inhibitors, as nurses monitor blood pressure carefully and ensure patients sit or lie down after taking nitrates. Anticoagulants like warfarin are used daily with international normalized ratio-based adjustments to prevent thromboembolism in conditions like mechanical valves and mitral regurgitation with atrial fibrillation. Side effects include bleeding and bruising, with contraindications in pregnancy and bleeding disorders. Monitor international normalized ratio levels, assess for bleeding, and educate on diet interactions. Antidysrhythmics such as amiodarone control atrial arrhythmias, requiring electrocardiogram monitoring, and thyroid, liver, and lung assessments. Side effects include bradycardia, QT prolongation, and 4-amiodarone, thyroid, liver, and lung toxicity. Educate patients about photosensitivity and the importance of consistent follow-up. Amoxicillin is given before dental or surgical procedures to prevent infective endocarditis. Indicated in high-risk patients, mitral valve prolapse with regurgitation, mechanical valves, or previous endocarditis. Nurses must ensure the patient has no penicillin allergy and administer the dose 30 to 60 minutes before the procedure. Now let's move into vascular and venous disorders, conditions like peripheral artery disease, PAD, and venous thromboembolism. We'll look at medications used to improve circulation, prevent clot formation, and reduce cardiovascular risk. Angiotensin-converting enzyme inhibitors like ramipril are used daily for long-term therapy to improve endothelial function, increase walking distance, and reduce blood pressure and cardiovascular events in peripheral artery disease. Side effects include cough, hypotension, and hyperkalemia. Caution is advised in renal artery stenosis. Monitoring blood pressure, renal function, and potassium levels is essential. Antiplatelets reduce the risk of heart attack and stroke by preventing platelet aggregation. Used in PAD and cardiovascular disease prevention. Side effects include GI upset and bleeding. Avoid inactive bleeding. Monitor for bruising, bleeding, and assess GI tolerance. Aspirin plus clopidogrel is used in high-risk PAD patients for enhanced protection. There's a higher risk of bleeding, so nurses must monitor closely and educate patients about signs of bleeding. Unfractionated heparin used as IV or SC for VTE prevention or treatment. Side effects include bleeding, HIT, and osteoporosis with long-term use. Monitor a PTT or ACT and know that protamine sulfate is the antidote. Never give heparin intramuscularly. Low molecular weight. Heparin, like enoxaparin, offers predictable anticoagulation for venous thromboembolism prophylaxis. Monitor for bleeding and rotate injection sites. Medications like apixaban, rivaroxaban, adoxaban, and fondaparinux prevent clot formation by inhibiting factor XA. Side effects include bleeding and thrombocytopenia. Fondaparinux is not used in severe renal impairment. The antidote is andexanet alpha. Educate patients about bleeding risks. Direct thrombin inhibitors like bavalarutin are used in heparin-induced thrombocytopenia cases with no antidote available. Monitor activated partial thromboplastin time/activated clotting time closely. Direct thrombin inhibitors like argatroban and dabigatran prevent clot formation. Used for venous thromboembolism, atrial fibrillation, and heparin-induced thrombocytopenia, they may cause bleeding. Dabigatran's antidote is idarucizumab. Monitor activated partial thromboplastin time/activated clotting time for intravenous use. Ensure adherence for oral use. Vitamin K antagonists, such as warfarin, inhibit clotting factors, requiring international normalized ratio monitoring. Side effects, bleeding and rare skin necrosis. Nonsteroidal anti-inflammatory drugs like ibuprofen are for symptomatic relief in superficial phlebitis, but can cause gastrointestinal upset. Give with food and monitor kidney function. Thank you for joining this medication guide review. Your understanding of these drugs is essential for safe and effective nursing practice.